Now we are in the third topic of the third unit. Third unit, which is CH22036, Unit 3. The third topic, electrical injuries, shock, burns, and electrocution. Electrical injury, shock, burns, and electrocution. Which has an introduction like this. Electrical injuries result from the passage of electric current through the body. The severity of these injuries can range from a mild shock to severe burns, cardiac arrest, and death. Electrocution. Electrical incidents are recognized as common hazards in various settings, including manufacturing and other workplaces. Types of electrical injuries. Electrical injuries can manifest in three different ways. One is electric shock, other one is electric burns, and the third one is electrocution. Electrocution, mostly they lose a life. Electric shock is the one which occurs. The electrical injuries can manifest in several ways. Out of that, these three are the most familiar ones which is happening there. The one first one is electric shock. Electric shock occurs when a body becomes part of an electrical circuit. It becomes it within the closed circuit. The body will also be there, which will be conducting. This can lead to a variety of psychological effect without necessarily causing significant tissue damage. Electric shock is also listed as a potential cause of unconsciousness. Electrical burns. These are caused by the heat generated as electric current flows through the body tissues. These burns can be both external as well as internal. Most of these times it is an internal one, but from the entry to the exit of the current. Significantly deep internal burns along the path of the electricity. That's what will be the electric burn. Because of electric burn, the damage will be there in the internal organs. Since electricity passes through the muscles, muscle damage will be there. Then the last one is electrocution. What happens is most of the time when the people go to the during rainy seasons, when the live current is there in the water area, that will lead to an complete electrocution. This electrocution refers especially to death caused by electric shock. The primary mechanism is often the disruption of the electric heart's electric. That is what there will be a cardiac arrest will be there. Heart electrical activity leading to cardiac arrest. Mechanism of the injury. The effect of electric current of the body depends upon several factors, including the voltage potential difference, ampere, type of current, whether it is AC current or DC current, the path of the current takes through the body, the duration of the contact, and the individual's physical condition. The sources highlight that an electric current can cause cardiac arrest. Furthermore, electric injuries can lead to hypoxia shock, hypoxia type of shock if the lungs fail as a consequence of the electrical shock. These are the five different ways whether the injury has been taken up, the amount of uh, symptoms and the effect. It depends upon the voltage and ampere. Voltage and higher voltage and higher ampere will lead to the severity of the injury. Type of current. Normally, the AC current damage is much more than the DC current. Alternating current is more dangerous than the direct current due to its ability to cause prolonged muscle contractions. Pathway through the body, the path where all the current is being passed, whether it goes from left hand to right hand, whether it goes from top to bottom. That is the pathway through the body, the pathway, the electricity which takes the organ damage, especially current passing areas, all the areas will get damaged. When the current is passed to the heart, certainly it will be a very dangerous, particularly very dangerous. Duration of the contact, the time taken for the electricity to pass through, that also matters. The longer the exposure, the damage will also go increase. Individual factors, age, hydration, and underlying health conditions can affect the injury's severity. These are the age will be one of the factors, and as well as individuals, all these things are also matters. These are age, hydration, underlying health conditions can affect the injury severity. Electric shock, electric shock and its psychological effect and assessment. When an electric shock occurs, the casualty may experience these four things. One is muscle contraction, breathing difficulties, cardiac arrest, and unconsciousness. Unconsciousness will be the last one. Muscle contractions. The electric current can stimulate muscles, sometimes causing violent, uncontrolled contractions that can make it difficult for the person to release the electric source. Breathing difficult. The current can interfere with the muscles controlling respiration, potentially leading to temporarily cessation of breathing and inadequate breathing. This will be the next one. Next, the third one is cardiac arrest. Disruptions of the heart's normal electric rhythm can lead to completely stop the heart functioning. The heart functioning is getting affected. severely, stops effectively. Unconsciousness. Electric shock is listed as a potential cause of unconsciousness, which is assessed by the AVPU scale. Alert will be the first one, AVP, and then again vocal voice with the gurts and moans. Then a third one is the response to the pain. Pain, sometimes they'll be able to locate, sometimes they will not be able to locate where exactly the pain, from where the pain is there. And the last one is AVPU. The last one is unresponsive. Unresponsive with no sound. That is what the AVPU scale, which is very easy to for us to identify the unconsciousness of the patient. Next comes electric burns. Electric burns, the characteristics in the treatment, which cause the appearance. Electric burns are caused by heat generation by the electric charge. It is important to recognize that while there may be a visible entry and exit wounds, the most significant damage can occur internally along the path of the current. The severity of the entry and exit burns may give some indication to the extent of internal damage is happening inside. Treatment comes in these four different ways. One is, first we have to prioritize the safety. The first and most crucial step is to ensure safety. That is, the person who is going as a first aider and the person who approaches casualty should ensure there is completely the patient is safe. Never put yourself in harm anyway. At the same time, the contact between the casualty and the electric current must be broken before we start doing the first aid, and as well as you can save him and as well as save you. That is, you can safely help them. The airway and breathing. Once safe, immediately maintain the casualties airway and breathing. So ensure the airway and breathing is completely free. In that condition, you will also be prepared to do the CPU, cardiac pulmonary CP. That you should be prepared, CPR. Cardiac pulmonary asthma, that's what, when you are being prepared, or normally when it stops also, if the casualty is unresponsive, certainly we can start the CPR. Resuscitation we can start. When it is not breathing, when he is not responding, certainly we can start this CPR. Burn care. Treat the external burn by trying to irrigate the area of the burn, including the area between the entry and exit burns for at least 10 minutes. After cooling, continue treating the burn as it be the dry heat burn. Normal dry heat burn, where blisters will not be there. This involves covering the burn with a sterile dressing. Seek immediate medical help. Dial the emergency number for any ambulance immediately in case of electric burns. Electrocution, prevention and response. Electrocution being fatal underscores the importance of electrical safety in the event of something being electrocuted. Do not touch the casualty. When you are understanding it is because of electricity, you should not touch while they are in contact with the electrical source. Disconnect the power before you attempting to help. Assess responsiveness and breathing and start the CPR if it is needed. CPR, cardiac pulmonary resuscitation. You start if then there is a need, then again, call emergency services immediately when something is much beyond the control. Electrical hazards, the workplace and prevention. The source, the sources mention electrical hazards as anticipated risk in industrial setting like power generation plants. These hazards include contract with the live parts, whether it is direct or indirect. Contract. CAEE, approach to live parts under high voltage. Electrostatic phenomena, effect of short circuits and overloads. These are the four hazards in the electrical area where we are there. Contact with live parts, whether it's a direct contact or it can be indirect contact. Approach to live parts under high voltage. At high voltage, we have to approach electrostatic phenomena, effect of short circuit and overloads. These were the hazards. How do we reduce the risk of electrical hazards in the workplace? It is essential to ensure all electrical equipment is properly maintained on ground. Regularly inspect tools and carts for any damage before use. Provide training on safely handling electrical equipment and the importance of the following proper procedure, such as lockout and tagout when working on or near the energized equipment. Employers should consider electrical risk while determining the first aid training needs. Employers should be planned well ahead. AED, that is you all know, automatic external defibrillator. That is AED. This AED safety considerations and electrical injuries. When using this AED, automated external defibrillator, on the casualty who may have suffered an electrical injury, It is important to note the following considerations. These are the four considerations which we will have. First one is dry chest. Ensure the casualty's chest is dry before applying AED pads to allow them to stick properly and to prevent the electricity from arcing, arcing across the wet skins. Medication patches. Be aware of any medication patches like GTN patches as these may explode if electricity passes through them. Remove any visible patches before administering the shock. Jewelry. Avoid placing the pads directly on any jewelry such as necklace and piercing as it would contact electricity and burn the casualty. So ensure remove all these jewelries. Metal parts should not be there. Implanted devices. Be aware of potential pacemakers or defibrillator implants. These are usually located below the left collarbone and should ideally not be in the path of AED pads. When to seek medical attention for electrical injuries? Seek medical care. Seek immediate medical care if the casualty has lost the consciousness or experienced any cardiac arrest. If the injury involves high voltage greater than 500 volt, there are visible burns, especially deep or widespread burn. Widespread burns means certainly you have to take him to the medical center or medical hospital. The casualty has difficulty in breathing. Casualty, when he says there's a chest pain, you have to take him there. The casualty has experienced an electric shock and feels unwell. If that is the case, also you have to take him to the hospital. The what never to do when dealing with electrical injuries. Never touch the casualty when the casualty is still in contact with the electrical source. Never use water to extinguish any electric fire. Never ignore an electrical injury, even if it appears to be minor. Never apply creams or ointments or to electrical burns. First, we'll have a case study one. The electrocution of the construction worker 2016 high voltage shock incident. The incident is happened on 2016 in a construction site. A construction worker in Texas, USA, he was electrocuted while working near a high voltage power line. He was using a metal ladder that accidentally touched an overhead 7200 volt power line. That is a mistake. Overhead. Overhead lines will be always uninsulated. So when you touch it, obviously the complete power comes to you. Impact. The workers have suffered severe electrical burns on his hands and feet. He went into cardiac arrest and died before reaching the hospital. Then comes this OSHA, Occupational Safety Health Administration. That group fined the construction company for not following the electrical protocols. The cause of the injury, the main cause of the injury, failure to maintain safe distance from the power line. That is one of the other issue. You should not have such kind of ladders or something near the building. Failure to maintain safe distance between the power lines. The next is use of conductive metal ladder near the live electrical sources. You should not use the live electrical wire. Where all electrical wire is there nearby, we should not use any kind of ladder. We should use only the wood structural non-conductors. Lack of worker training in electrical hazard awareness. So people should be having a full awareness. So this awareness will help them to put up in any of the companies and make use of the benefits. Lack of worker training in electrical hazard awareness. Next case study 2, NASA Apollo fire in the year 1967, electrical fire and burns incident. On Jan 27, 1967, during a pre-launch test for the Apollo 1 mission, a cabin electrical spark ignited the fire inside the spacecraft. Yeah, that is also, this is happening in the NASA. The cabin was filled with pure oxygen, which intensified the fire. That is what still further the fire got impact. The impact, three astronauts died due to the smoke inhalation and third degree of the burn. The fire led to major design changes in the NASA spacecraft, including better wiring insulations and fire resistant materials. Cause of injury, faulty wiring installations led to an electrical spark, highly flammable cabin environment, pure oxygen, inadequate escape mechanisms, preventing a quick evacuation. There was a large case study which is electrical, that is hotel worker electrocuted in a swimming pool in the year 2018. It is a faulty wiring. The incident happened in 2018. A hotel maintenance worker in Mexico died due to electrical shock while inspecting the swimming pool lighting system. A faulty electrical wire has leaked current into the water. That is what electrocution happened, electrifying the pool. Impact the worker was immediately electrocuted by the contact with the pool water. Multiple hotel guests suffered electric shocks with no fatalities among them. Authorities shut down the hotel and the owner faced negligence charges. The cause of injury. The cause of injury comes in three different types. Number one is exposed electrical wiring in a wet environment, lack of ground fault circuit, that is GFCI, that is ground fault circuit interrupters, no regular electrical inspections or maintenance. That also leads. Then we have the key lessons from these cases. Proper insulation and safe electrical practices prevent fatal shocks. Worker must be trained to recognize and avoid electrical hazards. Regular maintenance of electrical systems reduces this kind of electrocution risk. And the conclusion from this is electrical injuries can have severe and potential fatal consequences. Understanding the mechanism of the injury, recognizing different types of electrical injuries, and knowing the correct first aid procedures with a strong emphasis on safety are crucial for minimizing the harm and maximizing the chances of a positive outcome of the casualty. Immediate medical attention is always required for significant electrical injuries. These are the things which we conclude. Electrical injuries can certainly minimized by having a complete thorough understanding and at the same time having prepared for all kind of prevention measures. Certainly we can minimize and we can get it out of this electrical injuries. Because it's concluded. Thank you.